Hello and welcome to episode 83 of Tom's Hirschsprung's podcast. I am delighted to be joined by Anna Obendorfer, and we are going to talk about all about your son and his Hirschsprungs over the last couple of years or so. Welcome to the podcast, first of all.
Great. Yeah, I'm so excited to be here. Thanks for having me.
No, not at all, not at all. So I guess start usually where we usually start from the top with your son, if you don't mind.
Yeah. So my son's name is Sterling. He just turned 2 years old this week, which was a very exciting milestone for him. So yeah, he was born on June 2nd of 2003. I had a super normal pregnancy with him. I also have an older daughter as well. She is 4, just for context. And she does not have Hirschsprung disease. Um, so yeah, I had a very normal pregnancy. Here in the States, we get something at 12 weeks. It's called an NIPT test. It's like it's called NIP test for short. It tests for like the sex of the baby and for any kind of like chromosomal abnormalities. It's pretty standard here now. I'm not sure if they do it in the UK, but we got that done at 12 weeks. No red flags, nothing. We waited to find out if we were having a boy or girl until he was delivered. So we did not know that he was going to be a boy. But yeah, nothing on our genetic screening test. It doesn't screen for like intense, like it's mainly for like Down syndrome or trisomy, like things that are kind of more incompatible with life. So it wouldn't have ever been able to pick up the Hirschsprungs on there because you can't test for it. But just for context, totally regular pregnancy. I did have high blood pressure. I've had it with both my pregnancies. It was monitored by my midwife. Like I said, no concerns. Sterling was delivered at 40 weeks and 1 day. So he came 1 day after his due date. And what is interesting about my delivery specifically is there was actually meconium in my water when my water was broken. So our team there saw that there was meconium in the water, and at our hospital, the protocol is to just have extra pediatricians and baby nurses like in the room when they're born because inhaling the meconium can make it difficult for them to breathe or potentially like lead to an infection. So he was born, very easy delivery, and he came out breathing, great APGARD scores, and was healthy and very big. He was 8 pounds 4 ounces when he was born. But an interesting thing also that leads into our story is that one of the first things that I said to my husband was that I thought something was wrong with him. I just like when he was born had this like overwhelming kind of feeling of like something is wrong. And my husband had reassured me that I was tired. It was the delivery. You kind of can become paranoid as a mother about things that are not the case. I also have a background in childcare. I was a nanny for 12 years. I've taken care of a significant amount of infants and children. So I have a pretty good handle on baby care and what is more typical of a newborn and what is not typical of a newborn. And my husband had thought that I was concerned about like his breathing because of the meconium, which was in my head not what I was concerned about. I just like felt that something was off with him, and he had been probably born at this point. He was probably like 10 minutes old when I had said that, and the nurses all reassured me he was breathing fine. He looked amazing. They wrapped him up, gave him to me. We went up to postpartum because they move you in rooms here, and I nursed him, so he latched really quickly. He nursed really well, and he went to sleep. And we were delighted that we had a new baby. We were very excited. Like I said, I have a daughter, so it was exciting to have a boy, one of each. My husband was very happy. My daughter was born during COVID, so she was just shy of 2 at this point, and we had never left her, mostly because of COVID. We couldn't really do anything. And I was very concerned about getting home so we could be with her because she had never been left alone with anyone besides my husband or me. So our plan originally was we were going to do just 24 hours in the hospital we were going to be discharged, and then we would go see our pediatrician, who I have a wonderful relationship with, the next day. And as long as he was cleared for everything, was healthy, the team at the hospital agreed that was totally fine. As I had a great, easy delivery, he had no breathing issues. So we settled in for the first night. He just, like I said, I had a feeling that there was just something off about him. And he mainly, the first red flag to me was that he did not want to nurse, and he didn't want to nurse in a way that he just was uninterested in it, or he would have preferred a bottle. He just had no interest in feeding. He wouldn't cry. He just would look around and be awake for a little bit and then go back to sleep. We did all the tricks of undressing them, tickling their feet, keeping them awake. We offered a bottle because I was maybe he's just uninterested in nursing, even though he had a really big feed right when he was born. So I wasn't very concerned about it. The nurses were oh, it's been a couple hours since he's eaten. And I was yeah, I know. I keep offering him to nurse, and he's not interested in it. And they were oh, let's do all the things. And I was no, we are. He just doesn't want to. And by this point, he had passed meconium too. He had passed so much meconium, more than my daughter ever had. And he had already peed. So I was confident that he was not dehydrated. He had already passed the meconium, which meant that he was getting milk from nursing, because that's what pushes it out. So I was he just had a long journey here. He's tired. We're just going to let him sleep. And he would kind of rouse and act like he wanted to eat. He would eat for 5 minutes, and then he kind of wouldn't. And I was this is just odd, because a baby's primary directive normally is to eat. And if they're not eating, they're usually crying. And he was not crying. And my daughter was also a very mellow baby. She hardly cried. So my husband was this is just how our babies are. They just don't cry. And I was oh, okay. That's a little weird. And then, yeah, but no red flags. The nurses came, they checked him out. They did, here in the United States, they also do it's called a metabolic screening, where they do a blood heel prick on their heel, just to kind of test and make sure that nothing is going on. It's really standard. You do it before you leave the hospital. So he got that done. He got his hearing test done. Everything was great to go. We were discharged right at the 30-hour mark, with instructions to follow up with our pediatrician the next day, just because he was going home earlier than normal. Normally they like to keep you for 48, 2 days generally. But because we had already had a child and he was meeting all the milestones that they wanted, they were you guys can go home. And I was this is great. We went home. He continued to pass meconium and then started stooling just regular poop. Breast milk poop is really yellowy and seedy. It's very weird. He was doing that. I was a bit concerned that he wasn't peeing. I wasn't seeing a lot of urine in his diaper, which was a little bit of a red flag also to me. And at this point, he still wasn't nursing in the capacity or wanting to take a bottle or a passy. And he was just not acting to me what a baby acts like. And we had been warned that they say that sometimes boys are sleepier and they take a little bit longer to kind of wake up to the world around them, which I don't really know if I believe or not, but that was kind of our reassurance when I had brought up that I was he seems kind of just out of it, and he doesn't, I just kept saying he doesn't seem to have the desire to keep himself alive. He doesn't really have an interest in eating. He's not crying. He was sleeping for stretches of 4 to 5 hours that first 2 days, but he wasn't losing weight. So they were he's not losing weight. He's pooping, he's peeing, he's not dehydrated. Everything, his breathing is perfect. He's a perfect baby. And we were all right. So yeah, we came home when he was 2 days old, continued to just kind of take care of him. I still could not shake this feeling and was still expressing to my husband that I felt something was off about him. We saw our pediatrician the next day. She did a weight check on him. I had explained to her that I was a little concerned about his sleepiness, and I was concerned that like I wasn't seeing a lot of like wet diapers. And she had been like, oh, because he's like stooling so much, like you're probably just not seeing the urine in it because like there's so much like stool, and like we really want to see like him pooping because that shows that like he's getting milk, it's pushing everything down and out through his body, he's like clearly eating. And I was like, all right. He did have a tongue tie, which is kind of something common here in the United States that they check for because it can make latching difficult. So she noticed that he had a small tongue tie, and she was like, they just like clip it. It's basically just like too much, like, fabric is not the right word.
I know what you
Skin.
mean. Yeah. Yeah.
Yeah. So she had offered to clip it in the office. And I was like, okay, we'll do that. It was super quick. He didn't even cry when they did this, which was like, I was like, don't you see that that is bizarre? And she was like, no, like he's just like a sleepy baby. And she also was like, you're treating him like, when I went home with my daughter, she was like 3, almost 4 days old because we stayed the classic amount of time in the hospital. And she was like, you would still be in the hospital right now. So like you're anticipating him to act like a 3 or 4 day old baby when he's 48 hours old. And I was like, okay, that's fine. And day 3 rolls around. He kind of like starts to perk up in the day more, like he's awake more, he's looking around, but I'm still having a very difficult time getting him to feed in any capacity. Because I was like, let's give him a bottle, let's try to give him formula. Like I really need him to start eating because like this is not a normal volume of food that a baby should be taking in. But he wasn't crying still. He was just hanging out, looking around. And another day goes by. He's still passing stool. He's still peeing. He's doing all the regular baby things. When he was 4 days old, he started to drop weight at this point. And that was kind of like the first like actual sign that wasn't me just kind of being like, something's off with him. And I was like, okay, he's losing weight, starting to lose weight now. He's clearly not getting enough calories to maintain. We really need to focus on like getting some form of nutrition in him. So we did that. My parents came and my siblings came that day to see us and visit with him. And while we were there is kind of like they were there was kind of like the turning point. He really was like awake that day. He had a couple of like really solid feeds, but then he started spitting out. And I had my daughter had reflux. So like, I'm pretty comfortable with like a refluxy baby. I know the amount that is normal. So I was like, okay, here it goes. He's going to be a reflux baby. He's going to spit up. His stomach is now finally kind of woken up and is like, I need to eat. And he was crying a little bit more that day. And I was like, all right, I think like maybe we're out of the woods with whatever was going on with him. And while we were there, my parents were here. I actually caught my mom like looking at him in a way that like I could tell that she thought something was wrong with him. And she didn't say any of this to me. And I caught her looking at him like twice in this way where I was like, she knows something's wrong with him. And my parents laughed, and my mom did not say anything to me about this. But I found out months later that like when she left, she had spoken to my dad and had said that she thought something was wrong with him, that she couldn't put her finger on what it was. And my dad was like, let's just not say anything to Anna about that. Like, I don't really think it's our place. Which, funny enough, like she was correct and I was also correct. But like that kind of like was like gave me another thing about being like, I'm calling the pediatrician. Like, we're gonna go back tomorrow. I really want him looked at. And that night he started vomiting, like arcing vomit across the room, like so much force. And I was like, this is scary and very abnormal. And I had actually thought that he might have pyloric stenosis, which is like when there's like a blockage or a twist in your intestine, because one of the big signs of it is like this arcing. type of vomit. So I woke my husband up and I was like, this is what I think is going on. This is why I think he hasn't been eating, because like the twist would explain why he couldn't get anything down or through. I need to take him to the emergency room like right now. And he was like, what are you talking about? Like, we need to slow down. And I was like, no, I'm taking him to the emergency room. Like, you're going to stay here with our daughter. This is, and I kind of prepped him because I, at this point, thought it, like I said, was pyloric stenosis. I was like, he's going to need surgery. Like, if this is actually what it is. So I was like, you need, like, I just need you to know that. And like, we're going, like, I packed a bag, like a big bag. And I was like, we're going. And we live in Philadelphia, and we are extremely fortunate that like Children's Hospital of Philadelphia, it's called CHOP here, is about an 8-minute drive from us. Like, we're local, actually, like in the city. So that made this task also not so daunting, knowing that like we were going, it was right there. I had a very short drive. I brought him into the emergency room. I kind of like very quickly in triage explained he was 5 days old at this point. And I will forever give all the nurses in the ED there and everyone that we were with that day, because I could not explain what was going on. Like, I was like, the vomiting is one thing, but like something else is going on. And they immediately snapped into action, and nobody made me feel like I was ridiculous or that I was a new mom and I was exhausted or like I was anxious. They were like, okay, like, we believe you. We're gonna bring you back. Like, we're gonna figure out what's going on and it's gonna be fine. And they had also agreed, they thought it was pyloric stenosis. So they were like, we kind of need to handle this quickly. We need to get an ultrasound on him and make sure there's not a blockage or a twist. And once we can confirm that's not what's going on, we'll like start to work our way out. Had an ultrasound, no pyloric stenosis. And they were like, that's a great sign. And I was like, okay. And right after the ultrasound happened, I like picked him up and he wanted to nurse. So I was like, at this point, they were still just like, whatever he wants to do while he's here, if he wants to nurse, like, let's feed him. He wasn't on any protocols yet. So I had fed him and he nursed really well. And I like remember kind of having this thought in the back of my mind being like, oh my God, like, is he, like, I brought him here, all this stuff, and he's like gonna end up being completely fine. And then I picked him up to burp him and he vomited bright green. And this is the only instance that he's ever had bilious vomiting. But like, and I was alone in the ultrasound room waiting for like our nurse to bring us back down to the ED. So I like immediately took my phone out. I took a ton of pictures of it and like a video of it, because I was like, this is like, it looked like he threw up a highlighter. It was the brightest color I've ever seen. And it was all over the side of me. And our nurse walked in, and I will never forget her face when she saw, she was like, did he do that on your shoulder? And I was like, yes. And she was like, okay, we're going back down to the ED. And then they basically called everyone in. We saw like neuro, gastro, like every person was in our room. And our surgeon, who is our surgeon now, was the first person. He came down, and so many people that day had been talking to me about, they were trying to get family history and all these things. And was the first time I ever heard the word Hirschsprung disease, because he was like, does anyone in your family have Hirschsprung disease? And I was like, no, that's like a crazy word. Like, I would know about that. And I was like, no. And I remember just like very quickly brushing it off, because I was like, I don't even know what that is. Yeah. At that point, I had no idea. He hadn't explained anything of it to me. But luckily, he was like, there's a couple of things we can do here in the ED to kind of test to see if he has some symptoms of it. Because they were like, he does a little bit, like the bilious vomiting and like the kind of lack of appetite was the first thing. But they were like, he had meconium in the water. He passed meconium like way before the 24-hour mark. Like, we really don't think, this leads into our story a lot of like the first like month of his life of people just being like, we really don't think he has it, but was like what I heard all the time. So they were like, we can do a couple of things. Like, we're going to irrigate him. That was the first time I also heard that, where they were like, we're going to put the catheter in. We're going to see if any, like, they were like, an explosion of stool would be concerning. And I was like, okay, they did it. That didn't happen. I was like, cool, we're clear. Like, cross this off the list for me. And then they irrigated him in there, like down in the emergency room, because they had already had the catheter in, and they were like, it can't hurt to do it. Like, we'll just do it. And this is one of the things that I believe like truly saved him, because he was in the beginning stages of like going septic at this point, but we didn't know that. We hadn't gotten blood work done back on him yet. Like, they hadn't even put IVs in him or anything yet. Like, this was like, because he was still alert and fine. But like, I truly believe that like if they didn't do that, it like at least cleared him out and gotten some of like kept him essentially from getting enterocolitis, like because he was like on the verge of starting to get it. I don't know what could have happened, but thankfully they did that, and they were like, "You're clear," like because we see general, like this was our general surgeon, and so they were like, "GI is going to come in. We're going to do all these other tests." Long story short, in this process, he got like an upper GI. He got everything that they could do. He had 2 spinal taps. They did a brain MRI. They did like everything. And by the end of that day, they were like, we don't know what's wrong with him, but something is wrong. We're going to move him to the NICU. He's going to be there for at least 24 hours. We're going to get you out of the emergency room. We're going to the NICU. We go to the NICU. We're there for 24 hours, and then they come up and they're like, oh, we're going to do, I see our general surgeon again. And he's like, hi, it's me again. We can do this other test to like really try to rule out Hirschsprung's. And I was like, didn't we do that already? Like, what are you talking about, sir? And at this point, like Sterling was 5 days old. He had he had an IV in each hand. He had an IV in his foot. Like, it was a very scary situation because everyone in the hospital that we spoke to just kept being like, we don't know what's wrong with him, but like clearly something is. And every test that they were doing was coming back completely clear. Like his spinal tap was clear. Like they at one point maybe thought he had like a UTI, and like his body was like kind of like starting to battle that. And that's kind of where like the sepsis comes back in, because they were like, he is showing some odd like symptoms that could be sepsis, but like his blood work looks great. And like they were doing x-rays every day, and they were like, he does have something that looks like it could be like constipation at that point. But they were also like, he's on antibiotics, he's on so many medications, because the protocol when you get into the NICU is like you treat for sepsis even if you don't know it's there. So as soon as he got in the NICU, they started treating him for sepsis, which also is like what I think kept him alive and from getting enterocolitis, because he was on every antibiotic they could find, because they were like, it's better to just give the baby everything than the possible side effects of waiting until labs get back, because he was so little. And I was like, whatever you guys need to do it. And again, I will say the NICU nurses, the NICU doctors, everyone with the specialty that we spoke to was amazing and took their time of explaining things to me. And because I was 5 days postpartum, completely delirious, I was alone this entire time because my husband was with our toddler who had never been away from me. So like I was doing all of this completely by myself. And I'm very lucky that I come from like a slight medical background. I nannied for doctors and nurses almost exclusively, like my whole career of doing it. So I have a little bit more knowledge of kind of like at least the way that a hospital system runs. So like I know generally when rounds are, of like how to get in touch with the doctor if I need them, like kind of the protocols to go through, which when you're dealing with something like this and you're tired and exhausting, like not having to try to like navigate that was super helpful. And also having people that I could like text and be like, X, Y, and Z is happening. Like, what do you think? Like, do you think that I need to say more about this, or do I not need to say more about it? And that was extremely helpful, because I know I've heard parents like stories where it's very hard to be thrust into that like very intense medical environment when you have no concept of what is going on, and you're just trying to like, you're watching all this stuff happen to your tiny little baby, and you're like, what are you doing to them? And like, luckily, like I didn't have that feeling. I was like, whatever you guys feel we need to do, like we're going to do it. And they were always like on my side, which I feel so fortunate to have had that experience. And I'm forever grateful for them, because it really kind of changed the trajectory of like Sterling's story. But yeah, our general surgeon came back up and he was like, oh, like we're going to do a barium enema because it'll be able, like, we're going to put contrast in. We're going to be able to see if there's like narrowing or anything. And I was like, okay, like I thought we were done with this. So we do the enema, it comes back, and he had like a slight narrowing. That they were like, because of this slight narrowing, like we can't again fully rule it out. But like he pushed all of the contrast out himself, and they were like, that in itself is a great sign. Like again, we heard he probably doesn't have this, but we can't tell you with like 100% certainty. But everyone else was kind of like above our general surgeon at that point. Like we were seeing like neurology and all of them, and they were like, this is the least of our concerns. Because he still wasn't improving at this point. Like he kind of just like plateaued. He was on TPN, so like they didn't want me feeding him because they wanted him on like bowel rest because of like the antibiotics he was on. They were like, it's just better for his system if we're not introducing any new variables. So like he couldn't eat, and that also kind of like was like they were like, we don't really care that he's not stooling a lot because he's on TPN and he's on all these antibiotics. So it was kind of like they were like, this is not something that we need to worry about. He was in the NICU for like 36 hours, and then they were like, we can move you out. He's like too healthy to be here with these babies, but like he's nowhere close to being ready to go home. So they moved us to a different part of the hospital, and we were there for maybe around 4 days, I think. And they basically called him like a feeder and a grower. They just were like, we're going to slowly start adding food back into his diet and see if he can tolerate it. They put him on a pretty intense reflux medicine, and they were like, maybe that is what it is. And because still everything was coming back normally. So like he finished the rounds of the antibiotics, and they were like, okay, we can take him off of that. And then when he was done the antibiotics, they're like, let's slowly like introduce some like food back in, because we're like lucky he never had to have like a feeding tube or anything, because he was a decent size when he was born, that when he was on the TPN he wasn't losing any weight, so they were like, let's just leave him be. And then we first started to introduce a bottle because it was like easier to control the flow and tell how much he was getting. It was still breast milk because I was pumping this whole time, and he did great with it, didn't spit up. They were like, great, let's do another feeding. And then we kind of just like slowly weaned him off of everything, and he started to look great. And they were like, everything has come back clear. Everything continues to come back clear. His x-rays look great. Everything looks great. Like the reflux medicine seems to be helping with the vomiting. He had no more instances of the bilious vomiting, the green vomit. And he was like 11 days old, 12 days old at this point. And one morning they came in and they were like, how do you guys feel about going home today? And I was like, what? And they were like, he's been off the TPN for like 2 days at this point. He's off the antibiotics. He's never had a fever. All of his blood work came back. His platelets look great. His cells look like everything was perfect. And I was like, but you guys didn't figure out like what it was, like why all these odd things happened. And they were like, we can't find a correlation to it. And I spoke to all the departments, and they were like, sometimes babies just freak out when they're born, and their bodies kind of start to shut down, and they just need like this jump start. But like, we feel like we've done everything that we can do. Like, we're going to send you home. Like, obviously, if he starts the arc vomiting again, or he gets a fever or any of those things, like this is, there's kind of nothing more that we can do for you here. And he's doing really well. He was gaining weight. He was awake. He was nursing. Like he had been nursing like exclusively again at that point. And I was like, okay. And at that point, like I had been at the hospital the entirety of the time with him. And I was at the point where I was like, I need to, like, if you're saying we can go home, like I need to go home. Like I need to get out of here. And our wonderful general surgeon, like, because everyone rounds with you before we leave, like he popped his head back in again, and he was like, I want to do one more thing. And I was like, you're joking. And because he was like, I want to do a biopsy. And I was like, no, we just like talked about getting discharge papers. Like, you're not doing that. And he was like, it's a bedside biopsy. He was like, I can do it in 5 minutes, and it's not going to impact you going home today because we have to send it out to pathology. If anything, you're just going to have to come back to my office in like a week. And I said no again. I was like, no, you told me all of this was not an issue. You're telling me every time I see you that he doesn't have any of these like symptoms because he's stooling, he passed meconium, blah, blah. And at this point, still, I didn't even know what the biopsy was for. And then he said Hirschsprung disease again. And I was like, you're kidding me that we're doing this again. And he was like, can I please do it? And I was like, fine, get it done. We're going to do it. And he was like, okay, which is the greatest decision I've ever made in my life. Thank God I did it. And he did the biopsy. It was really quick. And then when he left, I was waiting for our discharge papers. Was the first time that I like actually like Googled Hirschsprung disease because so many other things were going on. And I was very focused on not like going down a rabbit hole of every type thing that somebody told me. I didn't want to have like too much information. And I Googled it, and CHOP is like one of the main hospitals here that does it. And like they have like little video testimonies of like the specialty kind of departments. And so I watched it, and the child that they were talking about and his parents and everything, I was like, he had every one of these symptoms besides the meconium passing. And I was like, what? And I remember calling my husband being like, I think he has Hirschsprung disease. And he was like, no, he doesn't. And I'm like, I really think that he does. Like, why did we do all this extra stuff if this could have been what it is? And I was like, I want to talk to the general surgeon again. He came back up and he was like, we didn't do this first because of so many other outlying things that were going on, and because he doesn't present in a typical case. I was like, okay, like, what do we need to do? And at this point, he was still stooling on his own. So like, he didn't send us home with saline or catheters. Like, we weren't irrigating him at all. And we went home, and he was like, the pathology is going to come back. I'm going to call you. You're going to come in the office. We're going to talk about it. Here you go. I was like, all right. We went home. We were home for a week. Sterling did great. No fever, no other symptoms. We were like, okay, we're out of the woods. This is over. This was like a really terrible chapter in having our baby. Get a call, and they're like, okay, can you come in? Your pathology's in. And I'm like, can't you just, why is it not in my portal? And I'm like, oh, because something is in it. And at this point, like, I had kind of like been doing a little bit more research, being like, okay, ganglion cells, what are those? What's the deal with this? He's still not having any symptoms of it, so maybe, I don't know. And we go in, we're waiting in the office, and here, like, the nurses can't give you test results, and our surgeon ended up getting like called in for a surgery, so they were like, just leave, like, we don't know how long it's going to be. And I was like, are you serious? So we left, and I called our pediatrician because she knew we were waiting on these results, and they like link stuff here, and she was like, let me see if I can like go in and see the results. And she goes in, and she was like, he has Hirschsprung disease, like, there are no ganglion cells present. And I was like, what are you talking about? So this starts our actual journey of like him getting his diagnosis. And we ended up going in the next day. They showed us how to irrigate in the office. We were really lucky that because he was irrigated in the hospital, he was on all the antibiotics. He didn't have like any stretching. We did other x-rays. So like we were able to avoid getting like a stoma or an ostomy because he had been stooling on his own, and there was no kind of like damage that we needed to correct. And he was like, I don't like to do pull-throughs on babies. I don't think that it works well for them unless we're in a dangerous situation. Like, we're gonna kind of just wait it out. If you guys are comfortable irrigating him at home, we will just do that. And then we'll do his pull through when he's 3 months old. And then he was like, we want to do a full suction biopsy to see if we can see how far it goes up. And he was like, we can do that when he's a month old because he has to be put under like anesthesia for that. But then we can do it as an outpatient procedure so that like you guys can go home that day. And like I said, we're local. So I was like, whatever is going to keep us not inpatient. So yeah, we went in, we did the suction biopsy. That also came back. Because they only do it in like, they can only get like a certain amount, to my understanding, when they're under the anesthesia. But like he was past the threshold of it being like ultra short segment at that point. Because he had also, our surgeon had also said like, if I see them during the suction biopsy, then like we might have to pivot our plan because like a pull through might not actually be the best thing to do for him if he has like ultra like short circuit segment, and because he has been stooling on his own up until this point, like it might not be the case, which is why we ended up doing the suction biopsy. So yeah, it came back and he was like, no, like I really think a pull through is the best thing for him. Let's get this on the calendar whenever. And our team at Chop has always been very like, they lead by like what I kind of want to do. They've always been like, you are the one home with him, caring for him. You know him better than we do. We can give you like our clinical diagnosis of like, you follow X, Y, and Z, but like, we're always going to default to like what you think is the best thing to do for him. So like, if you don't think that he's ready to get it done at 3 months, we'll wait. And we're super fortunate that like outside of that, Sterling has been extremely healthy. He's a very large child. So like we've never had any issues with like weight gain or anything like that I know some families can have at the beginning where they're waiting a certain amount of time to like make sure they're strong enough to go into this potentially very long surgery, depending on what happens when you get in there. So he had his pull through when he was 3 months old. It was super straightforward. I was prepared for like a very, very long day there. He was done, I think it was like from when they took him back to the OR until like they spoke to me, like when they came back out, 4 hours. Like it was so fast comparatively to like what I was thinking. And they have, our surgeon works with a specific pathologist for his Hirschsprung's patients that he like very much trusts, because he was like, it's not the actual surgery that takes a long time. It's like the reading of the pathology because they're doing it like live in the operating room. So he was like, that's what is going to be the bulk of like, that's what we're waiting for until we get the call of like where it was. And he had explained to me too, that he likes to take like a tiny bit more out for the transition zone. And at the time I also like didn't know what half of this meant. I was just like, okay, just do it. It's going to be fine. I had like a pretty basic knowledge. Like I said, like when we were speaking before, I was like in a lot of the groups, but I wasn't actively in them because it was very overwhelming for me at the time. So yeah, his surgery went great. He came out, he did great off the anesthesia. We had a little bit of like a tricky spot post-op with navigating like his reflux. When his stomach gets empty, even still now at 2 years old, he has a lot of like reflux, like the acid. So the being on the TPN and not being able to eat was very difficult for him the first night. Like he was in a significant amount of pain from the reflux, not from the surgery so much. Like our nurses were great. They were trying to keep him comfortable, but like I had really kind of like heavily advocated at that point, being like, he's not going to be comfortable until he starts to get something into his stomach. And I know we're waiting for like him to pass some gas or to have some stool, but like he was, because breast milk is also like very nutrient dense. So a lot of it, I've learned this like from our surgeons, absorbs. So like it doesn't create a lot of waste sometimes, like depending on how the baby breaks it down. So like, I was like, there's not going to be enough of like a push or a sensation if he's been completely off food for a significant amount of time. Like, how is he supposed to get things moving and wait for his bowels to wake up when there's nothing moving through there? And they were like, okay. He had like kind of farted a little bit at this point too. So they were like, let's give him like an ounce and see how he does. If he vomits, we'll go back. He did great. Like an hour after that, he pooped, which was like the first poop post pull through, which was amazing. We were like, he's doing great. And once he pooped, they were like, let's just let him do what he wants to do and see how he's going to go. And he snapped back to it. So yeah, we were only in the hospital for 3 full days. That's counting his surgery day. He had 9 centimeters removed, which I know is not a ton comparatively to everyone else. Not a small amount. It was a decent, most of his rectum, they said, but yeah, he did amazing. And so thankful for that. And we went out of there kind of fingers crossed, being like, this is going to be the last of it. And it wasn't, unfortunately. But we kind of just fell into the rabbit hole, like the hamster wheel, I like to call it, of like what seems to happen to some kids is that we had a toddler at home. He got sick with a respiratory thing. I think he was like 5 weeks post-op at that point. Nothing crazy, but it completely just slowed his bowels down to the point where like he stopped stooling on his own. We called our team. They were like, hey, we talked about this. This is pretty common with illness, especially with like little ones like this. Let's write it out. We started coming up with a plan. They were like, if he looks wonky at all, just irrigate him. And I have always like erred on the caution of irrigating because like pull through, we were irrigating him in the morning and at night. And he was little then, so it was like pretty easy. He's always tolerated it very well. It's been a huge just part of his life. So we're super fortunate that we're not wrestling an alligator. And we've always been very like, as soon as I found out his diagnosis, I've always been like very heavily consent based with him because it can be so invasive in his body. And our team is very consent based also. We've always been like, even when he was a newborn, we were talking him through being like, this is what we're going to do. Like, this is the catheter. It's going in. Like, we're putting the saline in. We're pulling it out. Like, we've just talked everything through with him. And our team has also done that at CHOP as well. They've always like explained to him what they're doing. They always ask, like, being like, we're going to look at like your bottom now. Hello. This is my cat.
Just saw her in the background.
Yeah, she likes to be included. So we're like, from the beginning, when I realized how all encompassing this disease can be, I was like, I really want to make sure that like we are setting him up for like as much of a positive experiences with this as we can. And it's been something that like I'm very proud of us and our team for doing, because like I said, now at 2, when we have to irrigate him, it's really not that big of a deal. Like, unless he has a fissure or something, like he's not comfortable. He knows when we're doing it. We tell him. I mean, he will express that he doesn't like it and he doesn't want it, but he also knows like we have to do it to keep you healthy. And if we don't do, like, we're doing it. And like my older daughter too, like it's just become so much a part of our life that doing something really hard to him is like, unfortunately, kind of part of our Hirschsprung's journey. But he has done remarkably well with the irrigations, starting because like he was like, yeah, like I said, 6 weeks post-op around when it started. And we tried to do let's add some prune juice in to there. Cause I was like, let's not rock the boat too much. I don't want to immediately throw him on a laxative when he hadn't even started solid foods yet either. That was the big thing where our surgeon was like, you guys are irrigating him a decent amount, because I was like, I'm trying to not have enterocolitis ever. Like ever. I don't want it. It's so scary. Anytime that he had a fever or weird, especially in the beginning days, I was like, it's just so much easier to like irrigate him, make sure everything is flushed out of there. That is going to be the best thing that we can do here at home. We're going to keep doing that. So like, I've always erred very much on the air of caution with the irrigations. Like I said, he's weird. We flush him out. Yeah. And I think that worked really well for us, because he did not get enterocolitis at all in his first year, and he was sick a decent amount just with respiratory stuff. And yeah, we tried the prune juice, did nothing. And then he started solid food. We were gonna wait until he started solid food at like 6 months old, because our surgeon was like, let's try to get some bulkier stuff in him and see if that jumpstarts everything. It did not, unfortunately. So we started Senna when he was like around 7 months old. And this is where we got into like the rash situation. We were managing it really well, and then it just blew up in our face. Like, and it was a very tricky situation of trying, because he was little at this point too. So it was like we were kind of limited on like what laxative we could give him that would come in like a form that he would take. And the Senna was working. Like we would give it before bed, and then he would have like one really big stool in the morning. And it was like, it was working, but it was so acidic that even though we were getting it off of his skin, it was just burning him like so badly, to the point where like we were almost admitted to wound care because we couldn't keep it under control. We couldn't keep it dry. And then he was like starting to get constipation symptoms. So he was like smearing a lot, and we would just change him, and then he would immediately go. And it was like, we couldn't go anywhere because he was in so much pain, and like his quality of life had gone down. This was the first time that like we had really seen like the quality of his life go down. And I was like, we can't do this anymore. So we called our team and they were like, just stop doing it. Move back to the irrigations. Let's let his skin heal. And what ended up happening was like he had like a fungal rash also on top of like the burn. So like as the like skin was healing from that, because it was damp all the time, it was like a fungal rash. So like we just used like an antifungal, like it was like foot cream, and it cleared everything up so quickly. And even now when he gets a little weird, I'm like, oh, we got to put some foot cream on his butt because it's probably because it's so damp. So yeah, we stopped all the laxatives at that point. We just went back to irrigating. Our protocol was like, we're going to irrigate him every 3 days if he doesn't have like a significant bowel movement that day. And that was what was working for us. If he seemed off, we would do it more. He was stooling on his own, but not a lot. This is really kind of when he like stopped, and it was like, okay, his body is becoming reliant on these irrigations to empty him out because it's easier. Those muscles are not working the way that they need to be working. Like they're overly tight. We were doing dilations for a little bit, but it wasn't doing anything to help. And our surgeon was like, there's a bunch of new research that says that maybe we shouldn't even be doing these in general. So he didn't have any like strictures or scar tissue. So he was like, in your guys' case, it doesn't really make sense for you to do them. So if you want to, go ahead. If you don't do it. So we stopped. And then he turned 1. We celebrated. He stopped nursing, which was a big thing because I was like nervous about switching him just fully over to food. Because like nursing was always extra calories, extra hydration. And it was always kind of like our fail safe. I was always like, he's getting what he needs from the breast milk. But I was uninterested in nursing past years. So I was like, we're done with this. You're going to be a grown-up boy now. So we turned 1 in June of last year. We ended up getting a second opinion just at Nationwide Children's Hospital because everyone raves about Dr. Wood. And we were super happy with our team. I talked to our surgeon about it, and he was like, hey, if we can get it covered by the insurance, there's no reason to not go. Anyone who can get more eyes on him is great. We work with them all the time. Like, I'm happy to send him out there and to send all the stuff. We ended up going out there in August. We saw them. They gave us no new information, which is exactly what we wanted. Like, they were completely on board with what our team was doing. They did a exam under anesthesia, and that's when he got his first round of Botox because it was in the works with CHOP at our hospital, but his skin was so thin still, and I kind of was like, my main focus was to like get his skin healthy, get him healthy. He was handling the irrigations fine, and I was like, once I feel like he's in a good place to like kind of go back to this maybe rash territory, we'll do the Botox. So he got around to Botox when we were at Nationwide, and it worked great. It's worked great for us. They started him on a different laxative. He takes it's like Duralax is what they call it here. So he takes like 5 milligrams of that every day. And since then he's had 2 other rounds of Botox. So 3 rounds of Botox total. The first were 3 months apart. This last round was 5 months apart. And for us, the Botox has really been a game changer. Every time he gets it, he's kind of been able to stretch longer before we notice that he's kind of going back to this like hamster wheel of like, does it make more sense to up his laxative? Which is what we kind of tried the last time we played around with his laxative dosage a little bit to be like, okay, now that the Botox is kind of worn off, maybe if we just like bump him up a bit, that can get him over the hump. But in his case, that doesn't seem to be working. He gets a lot of cramping from like any laxative that he's on. So like there are times where like he gets so crampy that he's just uninterested in eating. And then toddlers kind of don't eat anyway. And a lot of the kind of uncomfortable toddler symptoms of like they have a fever, all these things can also mimic enterocolitis. So it was getting complicated of trying to figure out like where he was. So yeah, we're kind of just like sticking to the Botox right now because it works. Our surgeon's happy to do it as much as he wants. He is not on a laxative from this last round. He's just been stooling on his own completely with the Botox. Like I said, he just turned 2 this week. So we're kind of starting to talk about like a long-term plan when it comes to like what we're going to do for potty training for him. We're really lucky that also at CHOP, they have like a bowel management that he is not on a
Yes.
yeah. So I was saying that, yeah, we just sit around a Botox. He's not on a laxative at the moment. We're doing like a magnesium, like it's a holistic magnesium like powder that we put in there every day. It kind of just helps like keep his stool softer so he
Mm.
can get it out, but it's not like a stimulant at all. So we're that's kind of like what we've been doing for him now. And then he did have one enterocolitis scare when he was like 13 months old. We all got the stomach bug and it kind of really knocked him on his butt. We were hospitalized for like a day and a half, just kind of to keep an eye on him. And then we went home on, what is it? The Flagyl, which is just like the most disgusting medication ever to try to give to a toddler because it tastes literally like metal. But he ended up like being able to take that, and we were just like irrigating like kind of around the clock, like 3 times a day for like a month until we started seeing the symptoms like dissipate. So like he didn't technically get diagnosed with EC, but I was like, I think the stomach bug kind of set him over. So now I like live in paralyzing fear of the stomach bug because I'm like, I can't go back to the hospital with a crazy 2-year-old who like runs around and now like tries to rip his IV out. Because I was like, wow, this was so much easier when you were a baby and you would lay there. Because this was like that last time in July when he was 13 months old was the first time that he was kind of like aware of being hospitalized and like could move and walk. And he's a brute. He runs, he jumps, he is not a kid that can be contained. So it was very challenging to, and that like he also like won't watch TV. So like it was like there was kind of nothing. And by the time the antibiotic had like started to kick in, he like perked right back up within like 8 hours. And I was like, this is going to be really hard to have you in here with your IV to keep it in, because like you have to be plugged in for a certain amount of time. So like that was very challenging. And I was like, oh, anything again that we can do to keep you out of inpatient is like always my priority, because it's just so hard to have such a young kid in a hospital room for them, for everyone. It's just kind of the worst experience ever.
Yes, I can imagine. But what a fascinating story. Thank you so much for
Yeah.
sharing the first couple of years. It's amazing. There's a couple of things that really stood out to me. One is obviously mother's intuition. I will always advocate for that. It is so important, not just from the people that I speak to, but from my own experience and my own mother. If it hadn't been for my mum's intuition, things would have been very different for me.
Yeah.
So I will forever be grateful for that and forever advocate for mother's intuition. And I guess from that point, if you feel something is wrong, is it? I guess the question to ask is, it's just a feeling, isn't it? I don't think there's anything you can quite put your finger on. Is it something like that? But you just
Yeah.
know.
I would say so. I have always like heard of other people like before I became a mother that it was potentially a thing that when like that it's just something that kind of moms know. And I always kind of had a general understanding and being like, oh well, that makes sense in a way. And like I said, I was a nanny for a long time. So like in any kind of form of caregiving, I feel like if you're really bonded with a child, there's a certain type of understanding that you have with them because you're physically taking care of them. But it was kind of nothing like I really anticipated. It was just like one of those things that like it just was. Like I just knew that something was wrong with him, like as much as I knew that like the sky was blue is the best way to like describe it. It's just like kind of like a thing that I just knew was the case. Like it had always been in my brain. Like even before like I knew him essentially. Because I didn't feel that way when I was pregnant though. Like I had no inclination that anything was wrong. But like as soon as I like saw him and felt him and looked at him, like that was the first thought that I had. I was like, something is wrong with him. And it's since I it gets tricky when you have a medically complicated kid because there's a certain level of anxiety that comes with that. And there or it has been times where I'm like, am I ignoring something because like I'm too caught up in my own head? And then I always kind of go back to that like feeling of like, you just kind of know. And when I have known that something has been off with them, like every time I have been correct, even with instances with my other daughter, it's not as strong with her. It's more of like that connection I would like just from like being her mother and her primary caregiver. But like with him, it's very like clear, like in my brain. Like I was saying, like it's just as clear as anything else is. Like I just know, and that is it. And it doesn't give me anxiety because I know that it will get solved because I'm like, oh, there's a problem. We can fix it. It's not one of those kind of like, oh, that's weird. He didn't eat as much today or something like that. Cause that's like more anxiety. It's like kind of how I would describe it, if that makes sense.
Yeah, yeah, it makes absolute sense to me. From people I've spoken to, it's not necessarily something you can. It's a feeling. It's not
Yeah.
necessarily something you can say. Oh well, it's this. And it's interesting you say you didn't have it during your pregnancy, but as soon as you know, you know,
Yeah.
it's again it's something I was always constantly advocate for. I think it's incredibly important, and I guess from that as well, because you knew something wasn't right, and they kept telling you it could be this, it could be that, or it's not this and it's not that. Was there sort of like a sort of a validation at the end that you thought, even though it turned out to be Hirschsprung's and you thought it was something else, did you think actually I'm really glad I persisted and I'm really glad that I was right in the end?
Yeah. I think that that feeling hit me like as soon as we got into the emergency room and I like the nurses like were not that I was looking for someone to believe me, but like one of the nurses like that she said that verbatim to me. She was like, I believe you.
Yeah.
And I didn't realize how like as soon as she said that and I was there, I like the relief that I felt. And I actually think that like because his journey was so there was just so many points to it and there was also just like so much that I didn't mention from like when we were in there because there's just it's not relevant anymore, but like the tests and all of the things that like by the end point like I was also just so because I was postpartum I was just so like kind of like broken from the experience that I'm so glad that our surgeon pushed me because I was at the head in the headspace of just like I can't go on with this anymore and kind of that feeling that intuition kind of like was satisfied in a way because like I had seen them do everything to take care of him. So like by the end of it, like I kind of was like, we need to get out of here. Like we need to live our life and all these things. But like I did have that sense of relief when we had gone into the emergency department and that nurse said that to me. Like I will never forget her face. And she was with us for like most of that time and then she was gone. But like I will never forget her face when she just looked at me just like very matter of fact and she was like, I believe you, and then just walked us back. And it was the one of the biggest reliefs that I've ever had and like taking care of just being like, okay, we're in a place now where like someone whose job it is will figure this out for me because like I'm his mother and it's my job to protect him and to advocate him for him, but like I'm not a medical professional. And he was like 4 days old at that point, so I was like, he's so tiny, what can I do besides like bring him here? So I'm so grateful because I know that a lot of people have not had that experience and they've had to like really fight and advocate so heavily for their children and travel and they don't have the quality care in their backyard that we do. And it has made a humongous like impact in like our mental health as a family and for Sterling too, to know that he's like growing up with these same doctors and these people that have seen him through when he was a baby till he's 2 years old. We bring him in here. The nurses love him. Unrelated to his Hirschsprungs, I had to take him to the emergency room the day after his birthday because I thought he broke his leg because he, like I said, runs around and jumps on everything. And we were in the emergency department and one of the nurses who knows us was like down there and because they get like a little alert when he comes in and they were like, you didn't call us. Like, what, is he okay? And I'm like, no, it's his leg. It's actually like not his Hirschsprungs at all. And she was like, I'm so relieved that that's the case. But then like he got to see her and we've seen our other nurses down there too. And it's like, I know so many people don't have the community of care providers around them that they so desperately deserve to have to feel heard and listened to. And it's like really changed. The Hirschsprung's diagnosis like changed our family, and it will always be different now. And we couldn't imagine our life like without it. But being able to have people that believe you and trust you and like want to do the best for your children, and also watching them care for the community, has been just like so beneficial for us.
Yeah, most definitely. And I know with Chop as well, from people that I've spoken to, both Chop and Nationwide seem very much to be the two specialist areas in America. So I guess it's well, very fortunate that you are. You said I think
Very,
8 minutes drive away from
yep.
one of the
We can,
best in the
yeah,
world.
yes, it's truly amazing. And like when we flew to Ohio, it was also just like an hour. I'm like, I just wish so much that everyone that needs this type of care like could get it.
Yeah.
And it's like so heartbreaking that that's not the case for like some of these families, and they've had such a hard time. So the like even just like within the Hirschsprung's community of all the people that like I've made posts of like with about his healing and all these things and like the information, and whenever anyone is like local-ish to our area, I'm always like, oh, this is our surgeon, we love them, like here's the protocol of like how to get in touch with them. And it's just been so nice to also be able to like kind of like pass that care along to like other families, especially ones that could potentially be like traveling out of state for care. We've like met up with families here that have come, and to try to like be able to have Sterling be around other kids that have Hirschsprung's, I think is like super important, that he has like peers that as he gets older he can like kind of like relate to, and they can share their story among each other, so he doesn't feel like he's the only one like going through this.
Yeah. Yeah. Oh, that's so important, especially for a rare condition, because you can, like I did, feel very much, well, nobody else in the world has what I have, and you think, well,
Yeah.
so to know other people, or certainly hear of other people that have gone through similar things to you, I think is invaluable. And then just sort of finally, before we wrap up, the future, I guess, for Sterling. I know you said he's just celebrated his second birthday, um, and he's obviously been through a lot at the moment. I know you talked a little bit about the Botox as well, but both sort of medically and non-medically, what do you see for Sterling's future?
Yeah, I think that's a great question. I think that we have really learned in this past year too, like there's a massive amount of like managing this disease that has to do with like his mental well-being as much as like his physical well-being. And we're really trying to figure out what life is going to look like now that he is older, and kind of towing the line of like leading kind of maybe by like his example of like how much information he wants shared with peers about these things. He hopefully will be starting preschool, that the school that his sister goes to next year, and they're familiar with him, so it's a good kind of place for him. But yeah, we're kind of just like figuring out ways to kind of like enrich his mental health, and making sure that he, as he gets older, has the space to like really talk about this, in the capacity that he wants to, and knowing that like there are going to be hard days, but they will be better, and making sure that he is not being isolated, and that this is kind of like his journey, and we're here to like at a certain point like we're going to just be here to support him, and we want him to be able to make decisions, for himself and what feels good for him. That kind of in the mental realm is like what we've really learned in this past year, that so like when you have a baby and you're just trying to get through it and keep them healthy, and then they're like a toddler, and then now you're kind of like grappling with this thing of like our next big thing coming up is like potty training. And like I have friends who have kids the same age as him that are moving into this phase where this is the first time where like he's kind of being left behind a little bit in an aspect, because it's not something that physically he is ready to do. We're in the building block stages to make sure that like when we do this, it's successful for him, so that it's not to kind of further isolate him. And so we can set him up to make this be the best experience, the best of kind of like a not great situation potentially. Like we want to do that. He's in pelvic floor PT. We're talking about starting the bowel management like boot camp, like what that would look like, what steps we need to do to get him to a place where like he's healthy physically and mentally to like do something like that. But it has been like an unexpected challenge of like watching some of his peers like kind of bypass him in a way of like they are now moving on to this next phase where he physically is just not ready to do that, and that's totally fine. But those aren't kind of milestones you're thinking of when you have a baby versus like having a toddler moving into like childhood and school and all those things. So like we're kind of just trying to lay the building blocks of that so that he feels prepared. And then yeah, from a physical aspect, like CHOP is our primary hospital. We love them. We're amazing. We're kind of just like going with the flow of if Botox works, we'll do another round. If it seems to not work, then we'll look at a laxative. We'll maybe start doing the bowel management boot camp and see if potty training can help him. We are continuing our care at Nationwide, mainly because they're great. They're just far away, and it's kind of not a great fit for us, just logistic wise. But they have a program where they transfer their kids into the Ohio State like medical system, where as an adult he would have transition of care, which CHOP does not have. And that is a huge thing that is obviously very far in our future. But I want, when he is an adult, when he is 18 and he's starting to age out of this like child medical system, that he's not starting from the floor, like ground zero essentially, of finding a surgeon, getting a doctor, getting all these people that like need to get to know him. And I don't want him to be just like a chart to somebody. I want him to have a relationship with his care team, because I think that is what is going to push him into adulthood in the best possible way, because we don't know what that looks like. We have no idea what his body's going to do, how he's going to react. So like that's a reason, a huge reason that we're staying with. We see Nationwide once a year now, and they check in with our CHOP team, but we physically go out there once a year so they can see him in person, see how he's doing, and so we can continue our care there. So like as he is an adult, he has continuity of care. So that's kind of like our main focus right now. And having him be a regular toddler who jumps off of things and breaks his leg is a very funny experience when you have a medical kid. Then when you bring them in for their non-medical things, he kept telling all of the doctors that came in that he was not there for his belly. He said, not belly, knee hurts, knee hurts. So he like, because he gets skittish sometimes because we've explained so many things. And I was like, we're going to CHOP, but we're not going like for your belly. No one's going to poke at you. You're not getting IVs. You're not getting irrigated. Like we need to take a picture of your knee. And he was like, oh, okay. But like everyone that came in that put gloves on, he reminded them that he was not there for his belly. He was there for his knee. So we're just very excited to watch him grow and succeed in any way, shape, or form that it is, because he's such a special, special kid. And we're very lucky that he is ours. We love him so much.
Oh, it's a fantastic sentiment to finish on. And I think the only thing left for me to say is just thank you so much for coming on, for sharing Sterling's story. And for sharing the journey you've all been on, and also just to wish you and your family just the very best for everything in the future, and no broken legs.
Yeah, no broken legs.
Thank you very much.
Yeah, no problem. Thank you so much for having me on. This was so nice to talk.